Hi, everybody. Welcome to Lafaya Way Live. Thank you for joining us. I am so happy to have one of my favorite people with me today. Hi, Dr. Nerissa, or Dr. Bauer.
Hello.
Have to be proper. Okay, so guys, let me introduce you to her. She is a behavioral pediatrician coming to us from Carmel, Indiana. She has a part-time behavioral health practice. She created Teach Me ADHD, a fantastic online course for parents of children who have ADHD. She hosts Let's Talk Kids Health Live, which is a fantastic show. I've watched it myself quite a few times. So thank you for all the wealth of information that you share. And she's also a spokesperson for the American Academy of Pediatrics and so much more, guys. She's like one of my favorite, not only docs, but one of my favorite people in the world because I love the heart that she has for what it is that she does. And I love the passion that she brings because it's just so rare that I get to see a passion like mine and hers, in the work that we do. So, hi, Dr. Nerissa. How are you
Oh,
doing today?
I am so good. I am so excited. I've been looking forward to this conversation, and I know we've had to reschedule a couple times, but I'm so glad we made it happen. So,
Oh, yeah,
thank you.
my fault, guys, not
No.
hers. Okay, so anyway, today we're going to be discussing how to spot comorbidities with disorders such as ADHD. We're going to discuss how to destigmatize mental health issues for both yourselves as parents and for our children. And we're also going to discuss steps to take once you find out that there are issues or there are some mental health struggles that your child is experiencing, and especially, how to address when there may be some additional, issues, because that can be really tough for both you and your child. Okay, so I think that first, Dr. Larissa, I'd like to start out with having you talk a little bit about how do parents who maybe their children aren't diagnosed yet, maybe they're not sure, but how do parents figure out, or what are some of the signs for ADHD specifically?
Yeah, that's a great question. I'm glad we're starting with that because, first of all, I want to say that, parents, first of all, you are the expert of your child. You know them, you've birthed them, you've been with them 24/7. And so I always tell my families to trust your parent radar if something is amiss. So I'm going to kind of answer in general what some of the common symptoms or behaviors, red flags are, but your own personal situation can be very different, and if that mommy radar or parent radar is like ding ding ding, like please don't ignore that. Okay, just because I don't necessarily say the symptom that you're seeing or concerned about doesn't mean that it's not something to talk to your pediatrician about.
Yes.
So, kids who think and learn a little differently, for specifically when we're thinking about the possibility of ADHD. So, there's several different types of ADHD. So, before people used to think ADD versus ADHD, we actually have done away with that. It's just all ADHD, but we characterize it by three different subtypes. There's the hyperactive impulsive subtype. So sometimes when kids have this presentation, they often are the ones who are always on the go. They're the ones that wake up and they're just like, boom, out of bed, and then they just can't stop until they go to sleep. They're climbing, they're moving, they're fidgety, they're talking, they're blurting out of turn. Sometimes those kids too can be the ones that you're worried about, like darting across the street. They use their body to show you a lot of things. So those are some examples of hyperactive impulsive things. The inattentive subtype is the other presentation. And so these kids typically come to my attention around third, fourth grade because that's when kids are no longer just learning to read, they're reading to learn. And there's a whole different set of skills that are required from their executive functioning frontal lobes. And it just, that's when we see an uptick in inattentive behaviors. So, what is inattentive behaviors? These are the kids that are easily distracted. They're the kids who can't complete multi step commands. They're the ones that look like they're daydreaming. They're the ones also that have messy, disorganized rooms or desks or whatnot. And those, again, are just some examples of that. There's typically there's like a set of 9 different symptoms for each of these categories. Now, I said 3, but I just told you 2. Well, The third presentation is combined presentation. So if your child is fortunate to have hyperactive impulsive and inattentive symptoms, you're combined type. Yes. Yes, extra lucky. And so, I mean, you have the spectrum of symptoms present. So those are just some examples of red flags. Now, all kids, especially the young ones, it's a little bit more challenging for pediatricians to diagnose kids with ADHD younger, but you can. The American Academy of Pediatrics has definitely published guidelines for diagnosing kids as early as age 4. But I think a lot of my colleagues in general practice, because they're dealing with ear infections and a bunch of other things too, it's sometimes really hard to know, is this still developmentally appropriate versus not? And so I oftentimes see the younger kids because because as a specialist, I have more time with the family and I can kind of observe them over time, because that's what makes it challenging for kids. Like there's a spectrum of what's expected, and we have to figure out what's normal and not.
So now, Dr. Nerissa, I have to tell you that it was actually, I had never heard of a behavioral pediatrician until I met you. So can you tell the parents a little bit more about that specialty area, and, and whether or not, and how do they decide, or how do they figure out whether or not they need to see a specialist versus their regular pediatrician?
Yes. So I get that question all the time. What is a behavioral pediatrician? Well, I am a general pediatrician by training. However, I loved this area of development and behavior so much that I did extra training in it. And so there is a board certification called Developmental Behavioral Pediatricians. And when I trained with a faculty member who was very much more the behavioral side of things. So I tend to see and work more with kids who have ADHD, anxiety, depression, parenting issues, school problems. The other end of that can include things like Down syndrome, feeding disorders, cerebral palsy, genetic issues. I got exposed to that, but I didn't get a lot of that. And so I tend to call myself more a behavioral pediatrician. So,
Oh, that's so awesome. Well, for me, it was really awesome to hear that was,
yeah.
something that was in existence, right?
Yes, yes. And so, I mean, I got trained to do all the, the ear infections and all that, but over time, I've just sort of honed my skills, and I've let my colleagues who are general pediatricians take care of those, because I really wanted to especially focus on kids who think and learn differently. The other part of your question was, when is it appropriate to have families seek out someone like me versus their pediatrician? I would say it kind of depends, because the general pediatrician is out there and they're the ones who build that rapport over time. They know your family from birth and they have seen the variations, and so it's really great to have someone in your corner like that, because a lot of what I deal with mental health and behavior wise, it's so important to know the context. We don't want to jump to conclusions, and there is no specific blood test or imaging study that I can say that says, oh, it's ADHD. Oh, it's depression. No, we don't do it that way. So having someone who understands and has seen the evolution of how your child has grown is really great. And so you can start with your pediatrician. And in fact, many of my colleagues can identify and start treatment for ADHD. The issue is sometimes, like I said, sometimes the younger kids, the 4 to 7-year-olds, sometimes they might not feel as comfortable starting medication or knowing how to help families, especially in that time window. So I'll tend to see some of those kiddos or kids who have a diagnosis. They've tried a couple medications or a couple other therapies, and it's still not improving. And again, that's when I'll oftentimes get referrals from my colleagues.
Okay, now parents out there, I hope you heard that. If you tried a few medications and you've tried
Mhm.
a few things that you've been asked to try and that's not quite working, it may be time to ask or make a request to see a specialist, a behavioral pediatrician. So
Mhm.
that's actually really cool information. Thank you so much. Okay, so now I know I mentioned earlier can I get the words out? I can't even say it right. Comorbidity, right?
Yes,
And most
yes,
people can't even say it like me, can't even say comorbidity. So
yes.
first, can you help kind of define what that means? Because not everybody knows. And
Hmm.
then share what comorbidities are often common for
Yes.
kids with ADHD and, other disorders as well. But, you know, what are some that are common?
Yes. So ADHD, as I said, all the mental health conditions, again, there's no specific blood test or anything. What it comes down to is understanding the child's behavior, the patterns, and how it affects the child at home and school. If it's just isolated to the parent and child interactions, or is it the child is sharing and showing these behaviors across settings? So these are things that myself or general pediatricians need to inquire about, okay? But because of that, we also know that kids who think and learn differently, and it's not a perfect science, right? Um, but we also know that kids who have attentional issues, oftentimes they are more prone or are more likely to later develop anxiety, depression, learning disabilities as well. So when you embark on this road, it can be really hard for parents because, obviously you want your child to be healthy and thrive, and this might not jive with the image of, the childhood you want for your child, right? But it's really important to work with someone who's constantly reassessing and reevaluating, um, every year how your child is doing, because we know that oftentimes 2/3 of kids with ADHD often will end up with yet another type of mental health or condition. ADHD never runs alone. So it is what it is. And so don't feel badly if, like, let's say your child has a diagnosis of ADHD and you're watching this and you're like, well, I've never heard about, like, if they have anxiety or depression. Be rest assured, the person who you're working with is constantly thinking about these things, because it is very common. And sometimes it just takes until like fourth, fifth, or even later years, because as your child is progressing through school and things get harder, it puts stress on those frontal lobes and that executive functioning. They're lagging skills, and maybe they're internalizing a lot of the feedback that they're getting, like, why can't you do this? Why are you not sitting still? How come you keep forgetting your homework? A lot of that negative feedback can really eat away at a child's self-esteem. A lot of times they get anxious, they feel kind of down on themselves. So again, we've got to be monitoring this for whether or not it's a separate condition or just kind of a side effect of not optimizing the current treatment for ADHD.
Right. And Nerissa, I love how kind you are to the rest of your profession. I
Yeah.
do. But I've been doing this for over 20 years, and I have no, it's not that I put down, other professionals. It's that I recognize that because it's not an area of specialty for many pediatricians, there's a lot that's missed. So hopefully there's some out there listening and, hearing, that oftentimes you're going to have these things paired with other issues as well, because that's not always kind of just, a point of knowledge. So
Yeah.
it's really
Yeah.
nice to hear you, it's nice to hear you talking about these things. And for me, I was so excited to actually have a pediatrician with so much knowledge in, on the mental health side, because that can
Hmm.
sometimes be this can sometimes keep parents from getting the proper treatment for their children.
Yep.
Yeah.
And I will say, can I just make one comment too? I mean, just again, because I love my general pediatrician friends out there. I mean, they have so many things that they have to do, give
Right,
vaccines, they've got to do all these other things. Their visits often are 15, 20 minutes. I
right,
mean, you can't do these types of things in 15, 20-minute visits. Believe me, I tried to train pediatricians to do this. And I'm like, why are they sending patients back to me? I thought I gave them all the skills they needed. Well, I mean, it's just the byproduct of the system, right? I mean,
right,
the expectation is they see 30 to 50 patients a day. And behavioral issues, you've got to really peel back the layers to really understand what's happening.
right,
And a lot of times they just don't either have the time, and it's not that they don't care, it's just that
right,
they've got to keep moving. And so,
right,
some doctors have social workers or other people housed in their clinic, which is amazing and awesome, but not
yes.
everybody does.
Yes, and no, and that's it. That, and I mean for each, they're to their own specialty area, right?
Hmm.
Because
Hmm.
and there are areas of focus that they are, they're set to work in, and most of the time that behavioral health piece is not it. That's why there's the need for specialty areas such as yours, and other specialists to come in. So that's awesome. Thank you, because you really, I mean, like, yeah, I've been doing this for a really long time, so I'm trying to make any like you.
Oh, oh, Debbie, look, I love this.
Oh,
It's
okay.
really
Well,
helping.
Debbie, thank you for your wonderful comment. We're glad that this is helpful to you. That's awesome. Okay. So we talked about comorbidity and what it actually means, something
Mm,
else on board. So tell parents a little bit about how to spot some of those other things that come up for kids who's, again, like you said, their brains are working too hard, or just socially they're not getting along with others and self-esteem is being kind of crushed throughout the years. People don't quite understand them. So tell us a little bit about how you spot that depression and that anxiety in some of those kids.
yeah. So again, for parents, I want you to know you're not in this alone, and it doesn't fall necessarily on your shoulders to do this. I know sometimes when a second or third diagnosis happens, some parents feel a little guilty, like, oh, I mean, I should have spotted this. I should have known. I mean, please take away the shoulds, because again, sometimes it's just the natural evolution of these conditions. But the key here is that when you start having that, radar going off, like something is just not right. Like all of a sudden, he was doing pretty well on the current treatment plan, but now I'm hearing just a lot more negative self talk. I'm seeing him get upset and more frustrated because he's missing assignments, or just like getting frustrated because he doesn't even know where to start. I'm getting frustrated because I'm trying to sit with him and it's taking hours, right? I mean, these things are really important to just kind of keep track of, and the key here is to not delay in bringing up these concerns, because again, the pediatrician, the specialist, they're going to need to know these observations and understand the context. Like, how long has this been happening? Does this affect your child from doing the things they otherwise love? Like depression, you know, it's common, and there is a difference though between, because everybody can have a down day and off day, but if it's a pattern, we're looking for patterns of symptoms that go on for at least 2 weeks or more, right? It's
Right.
affecting them not just in the home, but also across into school. It's affecting their relationships. They're no longer wanting to participate in things that they used to love. I mean,
Yeah.
those things, I don't think parents can ignore that. I think that you will see that, but it's not saying, oh, let's just wait and see if it gets better. Like if you're really worried, just call your pediatrician. They're
Right.
there to help figure this
Yes.
out.
Yes, that's awesome. That's awesome advice. Now we have a question from Lavelle Bolden. She's asking, is it possible that the pediatrician could deny a referral to the behavior to the behavior therapist or to the behavioral pediatrician?
Yeah, I would think that they wouldn't, just because as a general practitioner, they might want to try some things first, and that's okay too. I mean, I'm part of an initiative right now with the American Academy of Pediatrics that specifically is doing ongoing education for general pediatricians to help them identify and intervene early for anxiety and depression. Because
Oh, that's
guys,
awesome.
it's out there. It's out there. And the waits for seeing someone like me can be long. And so pediatricians love their families. They want to help. And yet they know that if they put in a referral, it doesn't feel good to them to have you wait 3, 4 weeks or months, and they want to do something. So I know the pediatricians themselves, depending on who they are out there joining things like this so they can learn how to support you, even if they are putting in a referral, so that way they can help you. So I don't think that they would deny it, but they may say, you know what, that's a great suggestion. I can go ahead and put in a referral, but I know that in our community it's taking 6 months. But in the meantime, here are some other strategies we can do. So
Right.
that's what I would hope would be happening.
Okay, that's okay. Awesome answer. Thank you. So in answer to that, the answer is, hopefully not, right? Hopefully they're searching
Hmm.
for other solutions. But if you find that some time has passed right, and you're still not getting your needs met, then that's something to kind of, advocate for yourself to have happen. Right. So hopefully they're
Yes.
trying to find a solution themselves, but after some time. And then also keeping in mind that, again, because the specialty area is it's small right now, right? There aren't very many out there. It may take some time to get in with a behavioral pediatrician. So please make sure that if you see things early, make sure to say something early. Because if you get a referral, it may take some time anyway. So, in all that time that you waited to actually kind of share what's going on with your pediatrician, you could have already had the process rolling. So the sooner you see things, the better, guys. If they're not enjoying things the way they used to, jump on it. Okay.
And nobody level, just let me just say, I mean, nobody can fault you for getting a second opinion, right? I mean, if you feel that your person, your physician is not hearing you, I mean, it's okay to go and seek out another opinion, because again, you cannot disregard your parent radar. I mean, you know your child best. You are the expert of your child. And if you are concerned, you have every right to seek out additional help from somebody else. And again, I don't know, I'm not going to be like talking about a specific person here, but again, sometimes it's just the way that, with people and communication, and that please make sure that you find someone who is listening.
Right. Thank you. That's an excellent point. You always want to make sure that you are working with, especially when you have a child who's having, challenges. You want to make sure that you're working with someone who you're comfortable with, who they're comfortable with, and someone that, like Dr. Lewis said, that you feel like is listening to you, because there's nothing worse than knowing that there's something going on, and there's nothing that creates more frustration for
Mhm.
everyone involved. That's the parents and the child, right? And everyone in the family, to not feel heard when they're trying to express that there's an issue, that it just makes things like 10 times worse than what you're already dealing with, right?
Mhm.
Okay, so when you figure out now that, okay, yeah, I believe that my child, there's something going on here in addition to, maybe the ADHD, or sometimes there's an autism diagnosis, or, something. But once you figure out there's depression or anxiety on board, then I know you mentioned that the first step is to, of course, mention it to the pediatrician. But then are there any other next steps that parents should take? And how do you feel? This is a two-parter. How do you feel like they should address this with their children?
Yes, this is an excellent question, couple questions. So the first is, if there is a second or third diagnosis, I think whoever is kind of overseeing the care of behavioral health, whether that be the general pediatrician or a specialist, um, they should update the record. And we look at not necessarily treating each individual one separately, because a lot of the therapies and a lot of the approaches can be the same therapies, even though your child may have ADHD and anxiety, right? Because cognitive behavioral therapy is often used across that, even for depression, right?
Right.
So we want to make sure to look at the whole child as a child, and not necessarily say, okay, for anxiety we have to do this, and then for ADHD we have to do this and this, because that can be really overwhelming. I
Yes.
think the key here is to look at the overall ADHD or behavioral health plan. And I often teach kids and families about this plan, so that way the parent and child can be at the center and help drive this, because a plan for one family will look very different for another family, because every family is unique. They have different circumstances and different needs, but the ultimate goal is to help your child thrive, right?
Yes. Yes.
And so we have to cover those five different pillars, so to speak, and I'll just quickly go through that. So the first is self-care strategies. You've got to get your child on board with this. It doesn't matter if they're 3, 4, 5. We can start talking to them about the importance of sleep, eating well, getting physical activity, getting outside, staying off screens, minimizing the use of screens, and really giving them ownership over that. Because if we can talk to them early and often about, like, hey, this is your brain, and your brain needs some good sleep, to function and to be able to feel good. And you doing this can all help your brain, right? And
Yes.
so, again,
Oh,
self-care strategies, right? And
oh,
oftentimes a lot of,
wait.
oh yeah, okay,
Pause.
okay, okay,
Pause. So
pause.
this is some of the
Okay.
excellence that we can't pass by the excellence of what you just said. So you actually pulled out. I think I saw you pull out a little brain.
Yes, yes. I,
So
I have
guys,
I have visuals a lot.
so
So
guys, visuals are excellent. So I wanted to pause there and say, okay, visuals can be excellent, especially for your younger child. It's important to self-care strategies because it helps your brain, right? I'm sorry,
mhm.
I had to pause there and have you like kind of poke that in
Yeah,
because
because I
these
mean,
things can be very helpful.
well, I mean, kids want to know why. They're naturally curious, and it's not just because I told you so. I
Right.
mean, you want to help you want to help them learn the reason, and there's a physiologic reason why. I mean, just I always tell parents, like, if you don't get enough sleep, we have the luxury of like downing coffee and caffeine, but yet we still don't feel great, and for kids, think about if they don't sleep well, it's just 1,000 times worse for them, because they're irritable, they can't concentrate, they can't focus. So we've got to start instilling in our kids the reason why this is important, to take care of our bodies and our brains, right? Okay.
Yes.
So
That's
self-care
awesome.
strategies. And oftentimes parents will start there, right? Because, and pediatricians will oftentimes, before we formally make a diagnosis of ADHD or depression, anxiety, we want to make sure we get the routine stuff off the table. Like, is it just because we don't have enough sleep? Once we
Mm-hmm.
correct the sleep, how is behavior? How is attention? Is that better? And if not, then maybe there's still something else there. Okay. So that's part of the thought process that my colleagues have in trying to figure out, because again, this is not an exact science. We've got to figure out what are some of the things that could cause poor attention, poor
Now, do you
emotion
ever
regulation.
do you ever explore things like diet
Oh yeah.
and exercise and all that?
Yes. Yeah.
Okay, so what are some of those? And I know you were going over them, but what are some of the check marks that parents should really start to focus in on for the kids? In addition to sleep, but what are some of those things that they check off as far as teaching the kids self care?
Yeah. So again, healthy sleep, and just again, I like to tell kids, this is why your mom and dad tell you to go to bed at this time, and it's not because they're just trying to be mean. They're trying to help you stay healthy as well as your brain, right? So
Hmm.
again, I try to kind of partner with everybody and help them understand that, because we know based on age, kids need certain amount of sleep at night. And again, when I'm taking a history, I'm trying to understand, is the child getting enough sleep as expected for age, and what's the quality of that sleep too, right? If they're snoring, are they sleepwalking, are they having night terrors? I mean, there's just so many things that we need to cross off and work through before we say, yes, it's ADHD, yes, it's this. Okay, we've got to always, that's what the physicians are doing. They're like trying to make sure that we don't jump to conclusions and really miss something, right?
Right, right. Okay, so excellent advice. Okay, so now I feel like, okay, we have another question. So let me just stop here. Shari says, awesome info. What is the earliest a child can be diagnosed?
For ADHD, 4 years old. And again, I think a lot of my colleagues in general practice, it's a little bit harder to do that. It's, oftentimes, just because they're kids at that age, they have shorter attention spans too. And there's also, there's this window where we're monitoring development over time. And so some kids might have been premature, some kids might have had something happen at birth that, causes delayed development. And so again, that's why the pediatrician is awesome, because they've seen how your child is developing across fine motor, gross motor, communication, personal, social, all the different domains of development. And it is on them to kind of help think through what else could be causing this, because behavior problems can be caused from language delay, fine motor delays, just kid getting frustrated because they can't button, they're trying so hard and they can't do
Right,
it, or because they don't have the words to explain to you, and so they have meltdowns, right? And again, these are some of the troublesome challenges that we hear about. And again, we need to know, is this limited to this situation? Is it happening in other situations with other people? That sort of helps us understand kind of what's going on.
Okay, awesome. Thank you so much. Okay. Now I want you, before we get ready to close here, I want you to share with everybody about your wonderful program, your wonderful course, Teach Me
Yes.
ADHD. Can you tell them a
Okay.
little bit about, because you know I love it. So can you describe it a little bit, give them a little information? How do they find how do they find you, all of that?
I will. Can I just go back and finish answering that one question though? The
Oh,
5 parts of the,
oh,
because I
five
was like,
parts.
I feel like I didn't answer that yet, and I don't
Well,
want
yeah,
people like watching this and be like, "Oh, wait, she didn't finish."
well, and I'm always getting ahead of myself. So
No, no, it's
yes,
okay. It's okay.
please
Um,
empower us.
Okay, so I'll do it quick. I'll do it quick. Okay. So the self care strategies, and then obviously there's medication. And I always get the question, is there a right or wrong time? And there's not necessarily a right or wrong time. It just depends on the child and the severity and frequency of symptoms. So that's another whole discussion we can have another time. But if you're curious about that, I have a video on my YouTube channel about it. Um, then there's behavioral therapy for the child to learn coping strategies and different skills that they need. Again, it kind of will vary depending on your child. They might need social skills, they might need organizational skills, because pills do not teach skills. That's the bottom line. Yes, medicine is needed, and sometimes it's the first thing we do. It kind of depends on the severity and frequency of the symptoms, just to help your child start feeling better. But I never, ever, ever start medicine without having the discussion that we've got to find the child a therapist, and parents also need support too. Okay.
That's so awesome.
I mean, it's true, because as a parent, it's like parents I know struggle with, like, gosh, I don't even want to start my child on and again, this is a whole other conversation, but but there's a lot of different things that we need to weigh through about whether or not start meds. But the key here is to just know that medicine pills don't teach skills, and we've got to give our kids the skills they need. And we can, and nobody has an 8 ball, a magic 8 ball to know if they're going to be the kiddo who needs to be on medicines as adults. But we want to set them up with as much tools in their toolbox, because they're going to need it. And we
That's
want them to internalize that they can do it, even though they have ADHD, even though they might have anxiety, even though they have depression. It doesn't matter. We want to
right.
give them the skills to make it through life, and this is how we do it.
Oh,
So
so awesome.
behavior therapy and parenting, and then working with the schools. That's the last one. So I know that was quick, but those are the different things that
Well,
we're
I'm,
always
I'm gonna
considering.
I'm gonna go over them again, guys, because this is important, and and she was right. We definitely needed to hear this. So the 5 areas focus in on: self-care, right?
Mhm,
Correct me if I'm wrong. Self-care, medication, behavioral therapy, parent support, and schools.
mhm.
Did
Yep.
I get them all?
Yep. Yep. Yep.
All right. Okay, good. So very important to make sure that you focus in on those areas with your child. But now, you guys, I want for Dr. Nerissa to share her fantastic Teach Me ADHD program, because it is just like a wonderful thing for any parent out there, who wants to know how to explain to their child how to work with, or how to function with ADHD better. She has a great program for that. So,
Oh, I love this program. And, as you know, I'm a behavioral pediatrician, and I've seen so many kids. And what I think is that sometimes it was born out of COVID time, where all of us had to sort of separate and stay away from each other for a period, because we just didn't know what was going on at the time. And yet we saw kids having to no longer do in-person school, remote learning, and that might be bringing PTSD for some families, because it was just terrible and a hard spot for everybody. We were all kind of just paddling water,
mhm,
educators, parents, everybody alike, right? But we saw also the side effects of this is that kids, especially who have ADHD, think and learn differently. Instruction virtually is harder.
oh my
And
goodness.
the COVID slide, and you're just trying to survive and not really learning, and so there's all that. But kids with ADHD, it's a chronic condition. Those 5 things that I just said, we need to get started, and we couldn't do that safely in the pandemic, or because everybody was kind of on high alert, nobody knew what was happening. It was really hard to get kids and into all of these different treatments. So Teach Me ADHD was really meant to fill the gap and a need, because when you have that diagnosis, it can be a really scary thing, not just for the parent, but for the child. I always try to remind families, when we're talking about the diagnosis, I always look at the child and I always talk to them about it, because sometimes, again, depends on who's doing the diagnosing. Sometimes they may say, oh, he has ADHD, and the child's in the room. But then sometimes, because usually we're talking to the parent, and then we're like, oh gosh, like, what's the next step? Like, then it starts going from there. But I really think that, kids, even as young as 4 or 5, they're listening.
Right.
And I think about, what is that child thinking right now? Like, oh my gosh, what is that? Am I gonna like die? Is this like something
Right.
that's bad? Like, so there's probably a lot of questions they have. And I wanted to offer something that helps onboard kids and parents together.
Yes.
Because again, all the things that I just said, typically behavior therapy is for the child, although, parents are involved depending on the age. They're involved like at the end, or they together, like there's different things. But then the parenting support piece is just for the parent. And that, like, so they're kind of all necessary, but oftentimes it's hard to schedule, and they're separate, and they're not necessarily done by the same person. So a lot of things can get lost in translation, or not done, because it's just hard. Just life is hard to schedule all these things all at once. So Teach Me ADHD is really designed. It's a 8-week class, remote. Yes, I know. And here I just said kids were struggling on Zoom, but I got it covered. So it's an 8-week class for kids and parents to take together. Kids 8 to 12, really, that's about the recommended age. But because it had to be on Zoom because of the pandemic, but I wanted to get families the access to this information, I knew it had to be on Zoom. So I made it fun and engaging with a detective theme, right? The families enter in the All Deeds Help Detective Agency. You become senior and junior detectives. There's a whole map, and you get a supply box, and there's deeds and family missions you guys work on week to week. We build on skills. Over the course of the 8 weeks, we teach kids about self-care strategies. We talk about emotion without commotion. We talk about organizing and school plans. We talk about all the different parts of the care plan. So that way, by the end of 8 weeks, kids have at least the skill set, the language. They've learned to work with their parent, because the parent is taking the class with them. And then they get to show off all the awesome knowledge and share their care plan with their pediatrician, because I want them to have a voice and to be at the table and start being able to own it. Own that, this is what I need. This is how the medicine makes me feel. Or I don't like this. It's okay, because I teach them the communication skills, not only to work with their parent, but with the rest of the people on their team. And it's a lot of fun for me. I love watching the growth that happens. And because it's a small group class, kids get to see other kids with ADHD. I mean, kids don't go up to each other and say, hey, I got ADHD. Do you? No, they don't do that. But a lot of these kids, it's so comforting to see the same kids and parents week to week, and then realize you have ADHD too. And like, just through the discussion and the things that we do, it normalizes it for them. But also parents. I've had parents tell me, wow, I was getting a little nervous because he's not sitting still, but like, I'm seeing all the other kids on there not sitting still. Okay, it's okay. So
Right.
I mean, it's really powerful. And I got to bring my A game, so,
Right.
and keep it fun and engaging. So I've got lots of fun activities. It's very interactive. And so I just love being able to do this work with the families. So,
Oh, that's awesome. Okay, so now how do people find you?
yes.
Where do they
Well,
go?
so my website is called letstalkkidshealth.org. And on there, you'll get to see my private practice if you're local in Indiana. You'll get to see my parenting book club that I have. I do my weekly show, Let's Talk Kids Health Live, and it has information on my courses. I offer my course 3 times a year. So agency doors are going to be opening again in August for enrollment for September, because I'm finishing up actually this Sunday with my current detectives. Yeah, and as of now, I've helped over 80 families across 12 states, and it's so fun. It's just so fun to like be able to bring together families who need this, and then seeing them gel. It's so fun.
Oh, that's so awesome. It's such a great community to create for your,
Yes.
I mean, it's above and beyond. So that's why I told you guys, absolutely love what she does. Thank you so much, Dr. Nerissa, for joining us today. You're so awesome. I
Oh.
know that I saw a comment fly by earlier from Lavelle Bolden that said it's so parent support. It's really nice to know that you're not alone.
Yes.
So, and parents out there, just know there are programs out there for you. There are specialists out there for you, like Dr. Nerissa, behavioral pediatricians with, and I'm sorry, those who go above and beyond, who create, courses for parents and children, or for families, so that they can learn together. The parents can be supported, but then also the children can be supported in understanding that they're not alone, right? That there are other children that are just like them, and they're all learning how to live as in their best version of themselves within, so most fantastic. Thank you so much for joining us, Dr. Nerissa, and I hope to meet with you again sometime soon. And I know, actually, I know for a
We
fact
are.
we will. But in this on this platform. So
Yes.
everybody
Thank
have a
you.
nice night, and thank you so much for joining us. You guys always remember to stay you, stay true, and remember, if you don't feel like you have the support, find the support. Have a good one.